Hi. One of the more common procedures that I perform is a breast augmentation with an uplift. And this would generally be done for patients who have either lost excessive weight causing the breast to deflate, or more commonly when women have had children and then after having the children their breasts have shrunken, the skin hasn't shrunken to keep up with the shrinkage of the breast size, and so the breast droops. And to correct the droopiness, the procedure is called a mastopexy or a breast lift. To add volume to the breasts, a breast implant is needed. So common questions are, can a breast lift be done alone? And or can a breast lift be done at the same time as a breast augmentation? So the answer to the first question is absolutely yes. A breast uplift can be performed without an implant. And this deals with, or this is decided based on two things. Number one, what's the expectation of the patient? If the patient is interested in a fuller, firmer breast, then they would require an uplift in most cases. If the patient just wants the droopiness corrected and has enough volume to the breast, then the breast can just be lifted and their own volume is used and compacted into less skin. Now the big question arises is, can these two be done safely together? And that answer is also yes in almost all instances. There are a few circumstances when it might be better to do them separately, just simply from a result and safety standpoint, not a health issue, but basically safety and cosmetic improvement in the breast. So if a patient wants to go very large with the breast implant, then that's not a good idea to do it at the same time as a breast uplift. When a breast uplift is done, essentially what's happening is skin is being removed in this area. The breast is then lifted and compacted into the less skin, and the skin on the sides is brought down underneath to hold the breast up. So that results in the typical anchor pattern of the incision going around the areola, straight down to the fold and in the fold. That is the workhorse of breast uplifts. It gives you the best result in most instances because most people are fairly droopy. In people who have just slight droopiness, you could do an incision around and down only, and that would be a short scar uplift. But a big breast implant or any breast implant sits up above the fold, tightening the skin up in the sides, and that skin is needed to be wrapped underneath when we do a full uplift. So a breast implant kind of fights against a breast uplift, but in the vast majority of patients who aren't wanting to use a large implant, it can be done at the same time. People who have a slightly abnormal shape to the breasts or who have had previous breast surgery might be better off doing the breast uplift alone and then the implant afterwards. And the most important thing to notice is two things. Number one, a breast implant fills the breast. It does not lift the breast. And a breast lift lifts the breast and in most cases doesn't fill the breast. So very common procedure, most of the time very nice results. Although there are a lot of incisions, they heal very, very nicely. And in my opinion, the shape of the breast outweighs the amount of incisions, which means if the typical anchor pattern around, down, and in the fold gives the best breast shape, that's what should be used. Plastic surgeons should not be afraid of making incisions because we're supposed to know how to sew them closed in such a way that there is minimal scarring, and that's generally the case. So I hope that's helped, and keep questions coming. Thank you.